Great. Hi, everyone. Today, it's my pleasure to share with you something special from my book. And for those of you who don't know about my book, the title of it is Nurse, the guide to empower new nurses in delivery of high quality care to all patients. I just want to let you know that I am aware of it, that there are many new nurses in the world at this time of the year because many graduations have taken place, and now we have new nurses who have just completed their NCLEX, yes, and they have been successful and they're ready to go. So I am here to encourage, empower, and give some suggestions that can help you on your nursing journey. I know it's the inception of it, and you're going to be feeling anxious at times. You're going to be questioning some things. You're going to be uncomfortable at times, but that's okay. That's normal. And there's so many challenges that come with nursing, although it's such a gratifying, it's such a satisfactory profession or career. So this time, I'll take time out just to say it is gratifying and at the same time it can be demanding. So I want you to prepare your mind. Have that mindset that there are times just like anything else in life, but because you are transitioning into this area from being a student nurse and have to move over or start having a different mindset, to be able to cope with the changes that will occur in your career. And especially at this initial phase where you are, you're going to be questioning many things. So for me, I've been there and others have been there, but I have also helped young nurses to cope and to transition, and they have done very well. Of course, there might be some time difference, depends on your personality, on you, the speed, how you learn, and different people learn differently. Some are visionaries, some the kinesthetic, like the touch, and so many different styles of learning and knowing. So you have to identify who you are. And of course, it is important to get help. And I say that many, many times. If you're not sure of something, ask questions. In addition to that, in my book that I've coined, I've taken time out to reflect on some of my experiences and see where I could have helped someone and where others helped me when I was a young nurse. That's many years ago. And I know there are many, many changes, of course, because we are in a changing world. We're in the 21st century. And I know for sure that I've put some nuggets in this book that can help you. And if you listen to other nurses, young nurses who have bought this book and who have got this in their position, they will tell you. There are many testimonials. And so you can also go on Amazon, and this is what the book looks like there, the guide to empowering new nurses in the delivery of high quality care. So in this book, as the content will tell you, you will be able to see things that you personally will embrace for yourselves. Okay. There are many concerns now because there are some trends that many people or many nurses are concerned about because there's a great nursing shortage. And during COVID, many challenges were experienced by many nurses. And that has given that has also one of the causes or some of the causes that have caused, I would say, complicates or complicated the process whereby we have the turnover, great turnover causing a nursing shortage. Or it has been short before, but because of COVID, some nurses um, were planning that they would have stayed on a little longer, but they have decided to go. And of course, some of them have passed and they're just not there. And also, some young individuals have gone to schools and they were saying, uh, they're not so interested in nursing because nurses work so hard. And so, but it is very satisfying. And so I'm just here to tell some young nurses that nursing can be gratifying, but at the same time, it's demanding. And there are challenges that you definitely have to face. We have to be upfront with that and letting our nurses know that nursing can be challenging, but at the same time, it is so rewarding. That patient satisfaction, and of course, your satisfaction. And how you can cope, you can definitely cope sometimes by making sure you do some self-care, making sure you research, making sure you have a mentor, which is so important. And that mentor does not have to be at your same hospital. It could be from somewhere else. It could be a friend. It could be a friend's friend. It could be another nurse from your same area also. So these are some of the tidbits that you should bear in mind. And as we move forward, patients need holistic care. And that care that's somewhat customized, whereby you're going to give the person personal care and also individualized care. So I hasten to say technology has been helping in so many ways, and we have changed. We no longer like write progress notes on paper and so forth. But what we do now is digitalized and it helps with documentation. So technology has brought us, oh, wealth of experience. And it's supposed to help so that we can deliver, market at the same time, better care to all our patients. So it's supposed to be complementary. But remember, technology does not take away you as a person. The recordings and all of that, that's okay. But that personal touch, that interest, that communication skills, that those communication skills that you definitely need to interact with others, those are nominal points that you should embrace as a young nurse. So I have just a few things here to say that nursing is always been in demand, and nursing also, it's a profession of the world that most people sought. That's the profession of the world. So it's a noble profession. And I'm just encouraging my young nurses that you have joined, you have taken on responsibilities that will help you. But don't forget to get some self-care as you go. Don't overwork yourself. And you'll hear some people say, or some young individuals say, I'm not going to nursing because nursing, they work so hard, they never rest. So I want you to remember this, that you should take time out for your rest, for your growth, your personal as well as your professional growth. Those key points are important. And let me tell you, let me hasten to let you know that those nuggets, those pearls, and others are in this book. Many of them. It's not taking the place of other books. It's taking the place whereby you can be helped. You can be, it will assist you if you would apply these nuggets as you grow from novice, which we all have been there at some point, and as you grow. So don't be so scared. You have just embarked on it. And believe me, in a little while, you'll be saying, wow, I've got it. However, don't forget those who are behind you, who are coming on. You're going to share. You're going to share. You're going to share so that others can be helped and that this noble profession will continue. So think about this. Your copy is on Amazon. This is what it looks like. Nurse, the guide to empowering new nurses in delivery of high quality care to all patients. You want to be on the edge, the cutting edge. And so this book can help you to develop some of your skills that you might be challenging or you have just embarked on. So get a copy for yourself, get a copy for your friend, get a copy. It's a gratifying career. I have no other profession but nursing, and I've just retired. And it has helped me to help others in different areas, not just in the nursing profession, but in general. Because as you embrace many, many attributes, many of these areas of the contents of this book, which are applicable in life, not just in nursing. So let me hope you get your copy. And how can you follow me? Because I definitely will be doing and sharing some of my expertise with those who are interested. Yes, you can join me. You can join me as I share with others and with you. Now, I'm on YouTube as Miriam Amanda Smith, Dr. Miriam Amanda Smith, and also I'm on podcast, Mir, and Instagram. I'm on Apple, I'm on Spotify. Podcast is Empowering New Nurses. That's what it's. So I look forward to seeing you. And if you do have questions, please place them or a comment, send them. If there's an area you would like me to zero in on for you, let's have it. And to get more information to me, you can just DM me at Miriam Amanda Smith Podcast Bear. Thank you. Thank you. Have a great day.